Hello. Thank you so much for taking time out of your busy schedule to learn more about the Buteyko breathing method. My name is Korina Flint, and I'm a Buteyko breathing instructor. I've worked for many years as a registered respiratory therapist, and I also hold the certification in clinical sleep health. One of my missions is to acquaint as many healthcare practitioners as possible with the benefits of the Buteyko breathing method, which is why I'm so glad you're here. The objectives for this webinar are: one, to describe the origins of the Buteyko breathing method and what it consists of. Two, there are so many different alternative modalities out there and even different types of breath work. So we'll go through some of the science behind why the Buteyko breathing method specifically works. And three, I've noticed that many, if not most, wellness practitioners do what they do because of their own wellness journey. So how could it help you as you continue to work on your wellness? And then as wellness practitioners, we take what has helped us and apply it to our patients or clients. So what types of symptoms and conditions can Buteyko breathing help for your clients or patients? There's a lot of emphasis on healthy diet, supplements, and exercise in alternative medicine, and rightly so. And why do wellness practitioners focus so much attention on these things? Because they know that our diet and how we supplement it affects every cell in our body. And regular exercise also affects the entire body. But what else affects our whole body? Breathing. To quote Mr. Miyagi from The Karate Kid Part 2, no breathe, no life. It's a basic fact that we need to breathe to live. But a less well-known fact is that how we breathe is also important. Just as how or what we eat and how often we exercise affects our health, how and how often we breathe also affects our health and our entire body. The average person breathes about 22,000 times per day. Every second of every day, our breathing keeps us alive and delivers precious oxygen to our cells, tissues, and organs. So imagine, as a wellness practitioner, you're working hard to help your clients or patients change their diet, change their movement, etc. But if their breathing is dysfunctional, there will always be something holding them back. I'll show more evidence of this as we move on to the science part of the presentation. I imagine you all have patients or clients that, despite your best efforts to help them, still suffer from many varied symptoms. You might feel stuck in your ability to help them. What if breathing is the missing puzzle piece? That's the question that Dr. Konstantin Buteyko asked when training to be a doctor in 1950s Russia. Dr. Buteyko noticed a paradox, that the more critically ill a patient was, the more they breathed. He saw patients near death taking big, gasping breaths while getting less and less oxygen. It just didn't seem to make sense why breathing more led to less oxygen, until he remembered the scientific principle of the Bohr effect. Based on that principle, he hypothesized that lowered carbon dioxide levels, or hyperventilation, from breathing too much were to blame for these patients' worsening condition. He was then also struggling with his own serious problem with dangerously high blood pressure. Experimenting on himself, he soon trained himself to breathe less and had shortly healed himself completely. After completing his medical studies, he went on to conduct clinical trials that confirmed this theory. He developed his method and went on to help many patients with asthma and other serious illnesses to improve or reverse their sickness, including his wife's serious asthma. As a wellness practitioner, you may already be aware of the Bohr effect. I know it's something that I was taught in respiratory therapy school. However, this may be a new application, so I'll just give a brief overview of the scientific principle and why it supports the theory behind the Buteyko method, why breathing less actually leads to more available oxygen, contrary to public belief. Discovered in 1904 by scientist Christian Bohr, the Bohr effect shows that an increase in arterial CO2 decreases blood pH, which weakens the chemical bond between hemoglobin and oxygen. This means that when there is more carbon dioxide in the blood near the tissues and organs, hemoglobin lets more oxygen molecules go, so there is more available oxygen for the brain, tissues, and other organs. I like to illustrate this for my students like a cargo train. The train cars are like the hemoglobin that picks up the oxygen at the station or the lungs. But if there aren't enough workers or carbon dioxide to unload the train cars, some of the cargo will remain on the train and not get to its destination. A vivid visual of this is a picture of an MRI scan from a study by Litchfield. First, normal breathing was observed, demonstrated by lots of yellow and red. Then, after only 1 minute of hyperventilation, we can see the markedly reduced oxygen levels in the brain. Of course, this same phenomenon is reproduced throughout the body when a person overbreathes. So this is a foundation of Buteyko theory, that by increasing the body's tolerance of carbon dioxide and restoring normal carbon dioxide levels, oxygen uptake throughout the body is improved. However, in addition to the role of carbon dioxide in oxygen delivery, CO2 itself has a powerful effect in the body. Western medicine seems to operate from the theory that CO2 is just a garbage gas that we exhale and it doesn't have any role in the body. In fact, there's a lot of emphasis on CO2 being dangerous, so we have all sorts of therapies to increase breathing volume. However, the science shows the opposite to be true. I think we're all aware of other instances where Western medicine has not caught up with alternative practices, for instance, in the field of gut microbiome. So what does the science show? Let's start with vasodilation. CO2 increases vasodilation, helping the internal diameter of blood vessels to increase. This leads to improved circulation. And also, since it takes less effort for the heart to pump blood, this leads to less work for the heart, which in turn can lead to a reduced resting heart rate and blood pressure. Carbon dioxide is also a bronchodilator, similar to quick-acting inhalers. Dilated or enlarged bronchial tubes are relaxed and easy to breathe through. This is why so many asthmatics have seen dramatic and quick improvements in their asthma symptoms when doing Buteyko. Dr. Buteyko proved this bronchodilation effect in his Soviet lab. In 2018, there was an animal study in Canada that showed this same effect. Carbon dioxide is a powerful natural sedative, so it helps relax the brain and nerves so that they're not so excitable. And oxygen itself is a calming agent, so the combination of normalized levels of carbon dioxide and increased levels of available oxygen can decrease anxiety, stress, and even seizures. There was a study that showed that inhaled carbon dioxide stopped seizures in rats. In addition to the fact that nasal breathing and breathing less decreases the number of harmful microbes we breathe in, which is, of course, something we're all concerned about in this time of pandemics. Buteyko breathing also promotes calm, measured breathing, which can help the body not to be in sympathetic dominance. This is one of the reasons that Buteyko strengthens the immune system, as sympathetic dominance is known to weaken a person's immune system. And since carbon dioxide increases oxygen delivery to the muscles, decreases sympathetic dominance, as well as calms down the nerves, it can cause tense and painful muscles to relax. And that's just a brief overview of what carbon dioxide can do in the body. So what does the method involve? The method that Dr. Buteyko developed consists of exercises done throughout intervals during the day to retrain the autonomic breathing patterns. Over time, breathing less becomes automatic. Students are also taught to switch over to nasal breathing and diaphragmatic breathing. You may have heard of Buteyko breathing in connection with asthma, as that is how it was first marketed when it came to the West. However, it's beneficial for many other disorders and symptoms, even when a person is not aware that they have a problem with their breathing. I had one student that had no breathing diagnoses But when she started and realized how low her breath scores were, she was really surprised, but it's been remarkable to see her improvements as she's increased her carbon dioxide tolerance. Again, this is because breathing affects the entire body. So even if somebody isn't aware that they have a problem, if they do have a dysfunction in their breathing, it's going to affect their whole body. So we can assess this by measuring a breath hold on exhalation, which we'll do together in a moment. Dr. Buteyko documented over 200 different disorders that the Buteyko breathing method can benefit. But here are some of the disorders and symptoms that can benefit. This might seem too good to be true at first, like it's a silver bullet, and that's really not what we're saying about the method. But the reason it can affect so many different things is because how we breathe literally affects us from the top of our head to the tips of our toes. It's not a cure-all, but all of my students that do the practice have seen benefits from it. I personally have experienced improvements in my asthma, migraines, sleep, fatigue, fibromyalgia pain, appetite, weight, and exercise endurance. Although I'm still on my healing journey, it definitely has helped me to get off a plateau I was on and up to the next level. I'd like to call out long haul COVID-19, which we're all seeing very much right now, also called long COVID or post-COVID syndrome, since so many people are suffering from these long-term symptoms. Interestingly, a study that came out at the end of 2021 showed that people with long COVID have low levels of carbon dioxide. Some of my students have reported improvements in these long COVID symptoms with doing Buteyko breathing, as well as getting through an active COVID infection more easily by practicing the method. So as we mentioned earlier, there are many different types of breathwork and breathing techniques out there. So why would you choose to spend your time on Buteyko breathing versus pranayama, box breathing, the 4-7-8 method, or the Wim Hof method? There can be positives in many of these breathwork modalities, but Buteyko breathing will provide more results for the time spent. Clinical studies have shown breathwork to be helpful for anxiety, stress, and high blood pressure. But because Buteyko addresses the root problem of breathing dysfunction, it affects a wide variety of symptoms that are rooted in dysfunctional breathing. So instead of just providing anxiety relief, impressive by itself, Buteyko could help a person suffering from asthma, anxiety, sleep apnea, and migraines to have improvements in all of these areas. Additionally, many breathing techniques focus on taking in a larger volume, which further decreases carbon dioxide levels in the body, which can actually worsen health. So you might be wondering, how do I know if I or my clients or patients breathe too much? Dr. Buteyko developed a simple test to see the state of a person's breathing called the control pause, or in the advanced Buteyko method, we call it an easy breath hold. Are you ready to try it? I'll explain how to measure your control pause, and then I'll give you a little time to measure yours. You'll need to get out a timer on a phone or a watch. You'll take a normal breath in, breathe out normally, and then start the timer while gently squeezing your nose. Breathing out normally does not mean that you should try to squeeze out all of your breath. There should still be a normal volume in the lungs. During the breath hold, some people like to close their eyes, others like to look off in the distance, but whatever you do, it's important to be really relaxed and focused, and it's best not to look at the timer or have any kind of goal in mind. We want to stay objective like scientists. At the first sign of air hunger, stop the breath hold and the timer and take a normal breath in. If after doing your breath hold, you feel the need to take a big breath in, you held your breath too long. And then what is air hunger? It's a mental or physical desire to breathe, and each person experiences it a little differently. But for most people, it's either a feeling of heat, constriction, pressure, or just the mental desire to breathe. And if it's a physical sensation, it's typically located in the upper chest, neck, or head. So just to review, you'll need a timer, relax, take a normal breath in, breathe out normally, and as soon as you've breathed out, gently pinch your nose and start the timer. stop the timer when you feel the first sign of air hunger or the need to breathe, and take a normal breath in. Okay, now whenever you're ready, we'll have silence for about 60 seconds so you can do your breath hold. Okay, how did you do? Most modern people will have a breath hold of between 10 and 20 seconds. This is an indicator of chronic disease. According to Buteyko theory, if your breath hold was in that range or lower, you most likely have one or more symptoms of chronic disease: fatigue, trouble breathing, cough, anxiety, high blood pressure, weight gain, allergies, skin disorders, and more. However, I wouldn't be surprised if you, as a wellness practitioner, have a higher than normal breath hold because you've done a lot of work on your health. However, according to Buteyko theory, optimal health is achieved at an average daily breath hold of 60 seconds or above. So even if your breath hold is higher than the average but less than 60 seconds, you could still benefit from your health and wellness by practicing Buteyko breathing. If you'd like to learn more, I can recommend two excellent books. Breath is a national bestseller written by journalist James Nestor and gives an overview of the importance of breath in health. Buteyko breathing is mentioned several times in the book. If you're looking to do a deep dive into the Buteyko method and the science behind it, the book The Breathing Cure is for you. It's written by an expert in the field, Patrick McEwen. There are a number of different styles of Buteyko out there. I personally teach the advanced Buteyko method, developed by Dr. Edward Ruvers. I tried another method as well that was a little bit more traditional, and I found this specific program to be gentler and easier to integrate into my life. The full course has 61 different levels, and I like their variety and adaptability. Additionally, having the app on a mobile device makes it easy to do on the go. The student gets to keep the app after finishing the course. And the app allows for easy tracking of breath scores, and charts are automatically produced from the numbers. The app also allows us to offer the course at a price lower than others on the market. The first course I took cost about $1,700 several years ago, so I wouldn't be surprised if it's more now. There are two courses, the intro and the complete. The intro course is designed for people who just want to try it out before deciding. The duration is only 5 days and consists of 2 virtual instruction sessions, teaching the basic levels of 1 to 4 in the app. The complete course typically lasts from 4 to 6 weeks, and you get access to all 61 levels of the advanced Buteyko method. I customize the levels and practice to each person so that they get the most benefit and have the most pleasant experience. There are 7 virtual instruction sessions. My vision is to increase the awareness of this method to reach as many as possible. To advance this goal, I'm instituting a special price for the course for wellness practitioners. Alternatively, if you have patients in mind that could benefit from the course, I can offer them a discount of 10% for the referral. Please contact me with any questions or feel free to book a free consultation on my site if you're interested in Buteyko for yourself, or if you would be interested in working together to benefit your clients or patients. I know that as a wellness practitioner, you're very busy, so I appreciate your taking the time to view this presentation. as how often